everyone, John Holt of Fox 4 News here, your virtual MC this year. And I know this is not how we really wanted to celebrate our 9th annual Outpacing Melanoma 5K, but let's face it, by now we're all getting used to adjusting with the current pandemic still in play. A nice spring morning running or walking with our friends would be a blast, and hopefully next year we'll be back at it. But this year we are going virtual and hope you'll join us because our event may change, but the need for your support does not. And that's why we want to begin with a big thank you and a shout out to our not so virtual, very real presenting sponsor, Burns and McDonnell. Thank you, Burns and Mac. Our platinum sponsors this year, also very real. Thank you to Tanya and Chris Crawshaw, the University of Kansas Cancer Center Melanoma Program, Commerce Trust, and Going the Distance, our platinum sponsors. Our gold sponsors for this year's event, Harlan and Jason Parker, State Farm Agency, Merck, and Bristol-Myers Squibb. Our silver sponsor, Reservoirs Environmental, and our bronze sponsor, PRA Health Sciences. Big thanks to all of them. And finally, some sponsors providing in-kind support. Heavenly Homemade, Starbucks, Till Media, and one I'm pretty fond of, Fox 4 Kansas City. I guess I'm the in-kind part, right? All right, to get you warmed up for your own walk or run, we're going to hear again this year from Dr. Gary Doolittle, an oncologist at the KU Cancer Center. He's going to update us on progress being made in preventing and treating melanoma. We'll also hear the very personal stories of some survivors and their melanoma journeys, always very inspiring. And of course, we'll recognize our top team and individual fundraisers, as well as the top team number of participants. But first, she's the inspiration for celebrating this 9th annual event. Can't believe it's been 9 years since she walked into Fox 4 and asked me to MC the event its very first year. How could I say no to a woman who's very passionate about the cause because it's very personal to her too? My friend and yours, Kelly Clover. Kelly?
Good morning. I'm Kelly Clover, founder of Outpacing Melanoma Foundation. Thank you for joining us today for our first ever Facebook Live event. This is not how we pictured our 9th annual Outpacing Melanoma 5K. We really miss seeing all of you this year and hope that you've been safe and well. Many of you have shared your virtual photos with us, and we've really enjoyed seeing how you've participated while practicing social distancing. If you're participating today, please remember to send your pictures to us at outpacingmelanoma@gmail.com or tag us on Facebook with the hashtag OM5K2020. I want to thank our 5K sponsors for your commitment and support as we transition to a virtual event. And thank you to everyone who contributed by donating, fundraising, or participating. Every penny raised will benefit research and the Melanoma Survivorship Program at the University of Kansas Cancer Center. Well, 2020 has certainly turned out to be a challenging year for all of us, but Outpacing Melanoma has not lost sight of our vision. Our focus remains the same, to fund research and increase melanoma awareness by promoting prevention, screening, and early detection. While the pandemic may have made it difficult to schedule that annual skin check, with as much time as we've all spent at home, there should be no excuse not to perform that monthly self-skin exam. And if you do have a mole that itches or bleeds, or a spot that is changing or growing, please get it checked. If it's melanoma, it's essential that you catch it early. We will now go to Dr. Gary Doolittle, physician and Outpacing Melanoma board member, for the latest melanoma updates.
Thanks, Kelly, and good morning. I too would like to thank you for participating in the virtual run this year. I can't believe it's been 8 years since that very first Outpacing Melanoma 5K. As Kelly indicated, I'm Dr. Gary Doolittle. I serve as board member for Outpacing Melanoma, and I practice as a medical oncologist that specializes in the treatment of this disease. I wanted to take a few minutes to discuss the treatment of melanoma in very general terms. I'd like to highlight some of the advances that have occurred, particularly for patients that have high-risk lymph node positive disease and for patients that have widespread metastatic disease. Whether you have high risk or metastatic disease, you can expect to live longer and you can expect to live better due to the anti-melanoma drugs we now have in the clinic. Immunotherapy. This has had an enormous impact in the lives of many cancer patients, particularly for those that have been diagnosed with malignant melanoma. For high-risk patients or those that present with lymph node positive disease, immunotherapy and some targeted drugs can help patients live longer and can, we think, cure a certain subset of that population. For those that have widespread disease, immunotherapy has been a game changer. These drugs work to stimulate the patient's own immune cells, and it's those activated cells that seek out melanoma and kill it. Recent advances in our understanding of what actually causes melanoma have also helped in the development of anti-melanoma therapies. If you have a melanoma cell, there's some particular change that has occurred in that cell that is causing this abnormal growth. We think many cancers are caused by an abnormal gene, a so-called mutation. The most common mutations in melanoma include BRAF, c-KIT, NTRK, and NRAS. We now have drugs that are specific for those particular mutations. They, when given to patients with a specific mutation, can arrest cell growth. They're called targeted agents because they target specific gene changes in melanoma. And now for any patient that has high-risk disease or for a patient that has widespread disease, we screen for all of these possible mutations because they can affect the treatment choices for a particular patient. So what does all this mean for the melanoma patient? It means living longer and it means living better. Up until 2014, the death rate associated with widespread melanoma was stable. We didn't have very good treatments for it. We were just beginning to see the effects of immunotherapy and targeted agents. And now with these newer drugs in the clinic, for the first time, we've actually seen a reduction in the lost lives due to melanoma. In the last 5 years, the death rate has dropped about 18%. And for some patients, even patients that have widespread disease, for the first time, we actually believe they're cured. As a melanoma doctor, it's been gratifying to see such remarkable advances in the treatment of this disease and in such a short time period. It's been nothing short of amazing. We're going to hear from some melanoma survivors. We're going to hear their stories. We're going to hear some of their insights. Again, thanks for participating this morning.
I put so much effort into tanning. I think about all the hours I spent laying out, and I put baby oil and iodine on me. And, I'm 50. And so I was born before there was sunscreen, SPF. It was always like tanning oil, suntan oil. And, the idea was to be dark. And my Grammy had a pool in her backyard. I'd get blistering sunburns when I was little, and I'd have water pockets on my nose, my forehead, and my shoulders, which were blisters, right? And nobody mentioned anything like, oh, maybe she's got too much sun, or, we should go inside or put a shirt on. And that was just kind of the 70s. And then I was a lifeguard and, outside from 8 a.m. to 8 p.m. every single day, getting paid to get tan. And then, of course, tanning beds show up. This is like 1987. And thought, that's easy. Go in there for 5 minutes, come out darker, a lot less time spent in the sun.
Stage 4 metastatic melanoma, and primary tumor is here. And then I had some popcorn tumors in my left lung. And I guess it makes sense if you would see my torso and you would see where my primary was in my left shoulder blade. I guess it makes sense to me that my lungs are where it metastasized to versus like my brain or my liver.
It's so overwhelming, when you are diagnosed, and it's changing slowly, but it used to be such an automatic death sentence. It's just so overwhelming when you're first diagnosed. So I would say, do what you can to not dive deep into all of the fear. There is a lot of fear. I was scared to death. But don't let fear be the first thing. Like, replace fear with facts, because the facts are people, me, are living so much longer with melanoma And I was diagnosed stage 4 on March 4th, 2013. And I was told I had approximately 9 to 18 months to live, which was not acceptable because I'm a single mom. My daughter was 9 in 4th grade. I couldn't leave her. And to be told that you have a certain amount of time left, it hurts your heart. It stretches out your brain. You're thinking, what are you going to do? How's this going to happen? And so I would say, take a minute, sit with the diagnosis, and then I would, if you got your melanoma diagnosis from a regular physician, I would reach out to an oncologist. I would try to find somebody who has an accreditation, who's familiar with melanoma, and they are the ones who it's their job to know what the latest, greatest things that are coming down the pipe. And so, make that appointment, ask questions, hear what they have to say, and then together, consultatively, you'll make a plan about, what's going to maybe be the best for you. One size does not fit all with cancer, and it certainly does not fit all for melanoma. The fact that I've been through everything I've been through, and I'm missing a lobe in my lung for melanoma, and I still want a little bit of color with a sundress, I get it, and so now I would just say, and I have said, please, 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 please don't ever go to a tanning salon. I think we just have to reverse this. And so it's just going to take a minute, and I get so impatient, but we're going to have to keep on, just letting that message out and just letting people know that, young people are dying from it.
I was diagnosed right after I turned 30. My daughter was literally turning 6 months old that day, the day I went to the dermatologist. I had a spot on the back of my left calf, and I had it there since I was pregnant with my daughter, but I didn't really think anything about it. It was just something that showed up. I also had a 2-year-old at the time. So I had a 2-year-old and a 6-month-old at home, and I was busy taking care of kids. And so when I went, the dermatologist took one look at it and pretty much said, why the hell weren't you in here earlier? At that point, it had spread to my lymph nodes already. I was stage 4 right then. When I was diagnosed, I was stage 4. I really didn't know anything about melanoma. I didn't know how bad it was, but I really just didn't know even how it happened or the stages or what it meant for me for the rest of my life, really. I had 2 little kids at home and didn't really, at that point when he said this is melanoma, I just was like, okay, well, now what do we do? And he's like, do you understand this? So I was like, I guess not. And he's that you have cancer and it's in your lymph nodes. I'm positive it's in your lymph nodes right now. This isn't good. And I just started bawling. The biggest thing that I would have wanted to hear from anybody at that point was that you have a chance. You can do this. It's not going to be easy, but you can beat this. I think what I wish I would have known was how dangerous tanning beds were. When I was growing up, it just really wasn't a big deal. You just did that for prom and that's what it was. During this summer, I babysat a lot. I went to the pool. I sunscreened the kids, but I never sunscreened myself. I did not understand how important reapplying sunscreen was, how important staying out of the sun was. It makes sense when I think back to, okay, how often because I didn't really burn. I tanned. I was one of those people that just go outside and I'm instantly tanned. Burning was not a common thing for me, but it happened several times. And that one bad sunburn is the one that always sticks out in my head. I remember I couldn't sit. I couldn't, it hurt everywhere. And thinking back, and I'm like, that's all it took was one bad sunburn. Now my kids know you don't go outside without that sunscreen on. That's just not okay. And they accept it, and it is what it is. The sunscreen's by the back door. They put it on and they go. It's just normal now. And I wish that would have been normal for me growing up. Wear your sunscreen. Wear your big hats. If you're going to be outside, wear the big hats, wear the long sleeves. I think people need to know how important it is to get skin checks. I would advocate that they need to at least be doing it every year.
I was just sitting in the living room one day, and I kind of felt a bump on my head, and it kind of was out of the ordinary, and I went to get it checked out, and it turned out it was melanoma. I had no idea. I mean, I thought I was an invincible young adult, so I had no idea what I was getting myself into, to be honest with you. Yeah, I think people should know that it can be a lot scarier than it actually is. I mean, I didn't think, oh, melanoma, it's not, out of all the cancers, I thought initially, melanoma is, okay, we can do this, but honestly, it can be very serious. Just be patient more than anything. I mean, it can be really hard, and it can be very frustrating for not only, me or my parents. I mean, everyone involved was very frustrated. So honestly, just be patient with it. I mean, it's a tough battle, but if everyone puts the right mind and positive look into it, then we could beat it and be better in the end.
It came out of nowhere. It was a complete and utter shock. I've got no history of any kind of cancer on either side of my distant relatives. So I was really caught off guard. Plus, I was a pretty healthy guy in my youth, being vain. I was usually out in the sun, and if I wasn't in the sun, I was in a tanning booth, and I had the attitude that could never happen to me. And then again, when you're at a younger age, you do feel invincible. And I felt invincible all the way up until 46. First off, you're diagnosed with metastatic melanoma, and it's all over your chest, inside, and then you find out you have a brain tumor. So obviously it is spread. So, it's already a big deal. We have this knowledge. I mean, you and I know for a fact that the tanning beds cause cancer, and I'm living proof of it. What more can I say? Do you want to go through the throwing up, the broken leg, the brain surgery, the treatments, all of that, just because you want to be a little bit darker? You got to know, if you're 17, 18, 19, we've all been that age. So let me tell you, it is not worth it. Get used to yourself being pale or pasty or whatever you want to call me.
When I was first diagnosed at 14 years old, I did not know what melanoma was. I'd heard of skin cancer because I lived in Florida for 7 years before that, but I did not know specifically what the disease or the cancer melanoma was. It is really prevalent though, melanoma. I think people think of it as a mole, and it's a mole that you have and you can get taken off. But to a lot of people, it's a lot more than that, and it can spread and it can travel, and it can be that deadly disease. One big thing that sticks out is my Eagle project. I didn't want to just have melanoma and just to have it. I ended up putting in sunscreen dispensers around the Sporting Kansas City soccer stadium, and that was something very near and dear to my heart and my family's. I would say believe that you're going to beat it, because that's the first step in beating something like this. You got to believe in yourself, and you just got to know that in the end, even however likely that it is that you're going to beat it, that you're going to, and you're going to get through it, And after you get through it, your life's going to be better because of it.
I had 2 bouts of melanoma. The first one was approximately, gosh, I wasn't prepared for that. It was approximately 10, 11 years ago. And then the next one was 2 years after that. My first diagnosis was just a mole removal. And I kind of went back to being a sun worshiper and even going back to the tanning bed, kind of getting just a little bit of tanning here and there, and my melanoma returned, and I was just kind of slapped back into reality. One of my things that I had at my table at Outpacing Melanoma 5K last year, they really need to ask themselves, is being tan worth what some of these people go through? All of the invasiveness, all the invasive surgery, and the downtime that you're going just to look glistened. There are other ways to get that look rather than the damaging rays and the damage that melanoma and skin cancer does to your body, and let other people know that it is a very aggressive cancer, a very preventable cancer.
I want to thank our survivors today for sharing insight from your personal journeys with melanoma in the hopes of educating others. As Melanoma Awareness Month comes to a close, we want to remind everyone to use common sense when spending time outdoors. Wear a broad spectrum sunscreen with a sun protection factor or SPF of 30 or greater, especially between the hours of 10 and 4. Remember, early detection and prevention are key in the fight against melanoma. So be sun smart and be vigilant in checking your skin. Thanks again for joining us today. We hope you'll save the date and that we will be back together again next year at Corporate Woods on Sunday, May 2nd, 2021 for our 10th annual Outpacing Melanoma 5K. Until then, let's outpace melanoma every step of the way.